Welcome, everyone. Recordings in progress. I need to click this away. Um, Good morning, everyone. Welcome to Geriatric Medicine Grand Rounds. You are in for a treat today because we're having grand rounds and learning from a really phenomenal medical educator. So it's going to be a great session. Our guest today is Dr. Bryan Brown, who is coming from the University of Hawaii, thanks to Zoom technology, which is great. He is a clinical assistant professor there in the Department of Medicine, but he's also an associate program director for the primary care internal medicine residency program. And in his spare time, he leads as the director of the Center for Learning Innovation at the University of Hawaii. And has done a lot of wonderful work in medical education. His path crossed with one of our faculty, Gina Kang, while they were both at Yale. He was doing his general internal medicine medical education fellowship while she was an advanced fellow in geriatrics. And they collaborated on a project together that you'll hear a little bit about as part of this. But I really want to thank you for taking the time to teach us today. It's always great to learn about new ways to educate. So thank you.
Great. Yeah, thank you, Kate. Thanks for having me. Hi, everyone. Aloha kakayaka. Good morning from Hawaii. The sun is not up yet here, but I'm grateful to start my day bright and early with you. Yes, thanks for that great introduction. I am here to talk to you about medical education passion of mine, which is the use of animation and other multimedia in medical education or health professions education more broadly. And in particular, I've crafted this talk today to focus on a geriatrics related project that actually, as you heard, Dr. Kang was a collaborator on. So diving right into it, so first of all, some disclaimers. So I'm not a geriatrician, I'm a primary care physician. I'm not a nurse, but I'm going to be talking about a nurse education project. I'm not a professional animator. This is a self-taught passion of mine, and it's 6 a.m. here. So all that results in a bit of imposter syndrome, and I figured that by saying that out loud, I'd do better than if I didn't. As far as funding, no major conflicts of interest, but some of the work you're going to hear about today was sponsored by a HRSA GWEP grant that I was a part of when I was at Yale. So our learning objectives today. So I want you to come away being able to just describe a systematic approach to creating and using multimedia, such as animation in health professions education. And in particular, where this is inspired from, as someone who is interested in medical education, even as a med student and a resident, when you start thinking about projects you might do, at least in the mid 2010s, inevitably someone would say, well, let's just make a video. Like, oh yeah, a video would be good. Let's make a video. And there are all these reasons we'll talk about why you may or may not want to make a video. But it seemed like people would just jump into these projects of making videos for education purposes, but no one was talking about what are the best practices? How do we know if we should make a video or not? And so I started making my scholarly focus, like, how do we know those things? Like, what are the best practices around this? And then in general, focusing on care of older adults and geriatrics, having you guys think about how do you appraise the potential opportunities and challenges for using these technologies for geriatrics education specifically. So I'm just going to pop over for a fun little video. Hopefully my sound is shared here. Whoop.
Hi there. My name is, yup, you guessed it, Brain.
And I'm Raymond.
And together, we're going to teach you about cognition.
What, you want me to say the dementia part?
Well, yeah, I thought you could finish it off there.
What? Then everyone will think I have dementia.
Okay, all right, I can see how that's problematic. Let's just trade roles and start over, okay?
Okay, fine.
Hi there. My name is...
So first things first, what is cognition anyway?
Okay, and so throughout this talk, we'll see little samples of our project, Cognition and Dementia with Raymond and Brain. If I can skip to, because I'm in the wrong window, that's why. Okay, so the way I'm gonna organize this talk and walk you through this is using this, which some of you may recognize. It's kind of the kind of the holy symbol of medical education, curriculum development. It's Kern's 6 steps of curriculum development. And so we're going to kind of walk through these steps in just really emphasizing how you should have a deliberate, thoughtful approach when you create any education project. And also I will point out now, because this will become relevant later, notice that there are also kind of omnidirectional arrows connecting all the steps. So it's not just about going in order, 1, 2, 3, 4, 5, but actually considering all the steps in parallel. And I like to juxtapose this image next to the picture on the right, which is a picture of Walt Disney and Webb Smith in the 1930s, Walt Disney Studios. Webb Smith invented the idea of the storyboard. And the idea is that before you spend all this money and all this time creating an animated film for Disney, you want to do an earlier, quicker step, which is to draw some pictures and plan out what you're going to do ahead of time. So a theme of this talk is going to be about, in any project you do, kind of the deliberate pre-planning steps as a team that save you pain, time, cost, and disaster on the back end. So the first step in that 6 steps is called the general needs assessment. So it's kind of like for the big picture of the issue you're trying to address, what you're trying to teach about, what's the lay of the land. And so you all are the geriatrics folks, not me. So this is my obligatory slide saying that the population's aging and dementia is, the prevalence of dementia is increasing. So I'll kind of breeze through these statistics. You all know these and better stats than I do. Furthermore, then we looked at the literature of saying, and as I'll speak to in a moment, this was a nurse education project we were tasked with. And nurses are the largest discipline of licensed health professionals in the US. They're well positioned to positively impact geriatric health. And yet there's limited training, education, and exposure to older adult populations in traditional nursing education. And less than 1% of registered nurses have an actual certificate specifically in geri. So then there's actually been some research done looking at this, like looking at nurses and nursing students and how do they feel about geriatrics or care for older adults? What impacts these career decisions? And and these studies have shown that there is some role for ageism, some misperceptions about their health needs, a general discomfort and uncertainty in providing care. And also these studies, when they looked at what learners wanted, what these nursing students wanted, they said maybe one thing to emphasize in these curricula should be the atypical presentations of different syndromes in older adults. So the idea of how depression presents differently, how a heart attack presents differently. And then also some learners said they wanted to make sure what they were learning was linked to physiology as students, which is kind of interesting. And maybe, in medicine as well, makes me think of maybe there was a bias that geriatrics was this more, I guess, less substantive or more fluffy subject that they could gloss over. And so if they tied it to this biomedical rigor that they thought, anyway, so these aren't my opinion, these are the biases of learners that were surveyed or focus grouped in prior studies. But so we started to look at this, and this is impactful, right? Because this tells us if we're going to teach nursing students about dementia and inspire the next generation to even consider this as a career and everything, we're not going to just have to focus on knowledge. We're going to have to focus on how they feel and their attitudes and their biases. And then, I pointed out earlier that curriculum development circle has all these intersecting arrows, and this is an example of that. So our general needs assessment, because I make animations, I was a hammer and I wanted to see a nail. So I wanted to know what is the literature about using animation as a teaching tool for nurses in general and or related to teaching dementia cognition. And for that one, we did look at also, but I'm gonna leave it as a cliffhanger for when I talk about animation more later. So we did a general needs assessment. And then we focus in on what's called a targeted needs assessment. So now you're looking at your target learner population. And so I'll tell you a little about where this was happening because I didn't give you enough context up front. So initially what happened was, there's a geriatrics department at Yale. They had this GWEP grant tasked with improving geriatrics care and workforce across the state of Connecticut. They had an arrangement with a local community college with a nursing school. And so I was brought in as the animator/educator to kind of work with them to see how we could spice up their curriculum. So initially we designed our curriculum based on the needs of this one community college. And so they showed us their current curriculum, they showed us their PowerPoint slides, their learning objectives. We had meetings with their stakeholders, their faculty, and said, what do you need? How do you organize your talks and things? And that was our starting point. But as we'll talk about in this talk, it's really great in a med ed project or any video or animation you make to make it count twice. And so after the initial studying and piloting at this community college, we then used it at Yale as well, at their nursing school. And then more recently, actually used it at a university-based nursing school in Hawaii as well. So it's nice when you put a lot of time into a project that takes a lot of time, like animation and video, that you can then use it at multiple sites. And they've even gone on back in Connecticut. I've given them free reign. They've even started using it and adapting it to other disciplines. So beyond nursing, can it be adapted also to medical students or people training to be medical assistants or home health aides or different things? So for local needs assessment, sometimes in a curriculum you might use surveys or focus groups. So we did a focus group, and we kind of just used convenience sampling. We had a flyer. We said you get a $5 gift card. We got 5 participants of nursing students at the community college who had already completed the existing curriculum. And we asked them a few things, right? So we asked them, number one, what are their feelings about dementia right now after a year of nursing school, and how was it taught about in their school? And then also, what are their feelings about how the modalities of teaching, and what do they think about using video and animation and different tools? So again, we're asking about the pedagogy, meaning the method of teaching, and about the content area as we prepare to do our project. So the results of that, just some quick highlights when we looked at the themes from this. And again, Dr. Kang was involved in this because we actually met in a qualitative research class, and so this was part of our work. Prior life experiences definitely support or thwart interest, and we'll see some more quotes from that in a moment. Again, just like the general needs assessment, there was definitely some aspect of rumors and stigma, focusing on older adults being combative and things like that. And then on the kind of pedagogical side, they did identify room for better integration of flipped classroom, multimedia learning options. So a quote here, they were saying, "A lot of us are mothers, a lot of us work. I need to just cut out the fluff. What is the core concept?" And they were kind of referring to these long reading assignments they were given that didn't get to the point, and they were hoping we would come up with some more efficient, eye-catching media for them. So another form of needs assessment we had was we did have a pre-survey at the first site at the community college when we then rolled out the video. So we were able to ask in a survey form, what things impact your feelings about caring for older adults and careers related to geriatrics. And in that case, there were these 4 big themes. So the first one was about that it's just related to fundamental skills in their mission. So one person talked about how there's always something new to learn and they should have an open mind. Again, the prior experiences piece came up again. So either, hey, I worked in nursing homes and it's a passion of mine, or hey, I had this sort of maybe challenging or traumatic experience with my grandparents growing up, and that makes me a little apprehensive about this field. The sense of being unprepared, again, I don't know what to do. They're so unpredictable, they're combative, all these kinds of terms being thrown around. And then some people positive or negative about the emotional aspect of this work, that either it's this great, compassionate, rewarding field, or that it might get too emotional, or they might get frustrated and they're not sure if that's the right workplace for them. So the point of all this, put simply, is when you all set out to teach your learners, and I understand this audience has, medicine, social work, pharmacy, nursing, kind of a spread, is remember that the average learner may not be coming in with the same automatic enthusiasm for geriatrics that you already have, and really being in touch with your audience and your learners to meet them where they're at and allay their fears and share with them why you love this field, and focus on the learner's attitudes rather than just the knowledge is something we learned very quickly. So we're kind of early on, but I promised I'd pause in case there are questions kind of at each of the junctures of these steps. But any questions so far? I feel like I dove in, and did I leave out any context or anything of what I'm talking about? Or yeah.
I'm not seeing anything pop up in the chat. Everyone's still thinking. I'm
Sounds
waiting
good.
for the next video, I think.
Right. Sounds good. So the third step of curriculum development is kind of my favorite because I'm a nerd, and this is writing learning objectives. And so sometimes I give a longer workshop and I have all these slides on learning objectives, but I whittled it down to just this one. So this is the movie SWAT from I think the early 2000s, some celebrities who are now older. But anyway, the reason I bring this up is I always start my learning objectives at the most basic level with students will be able to, or learners will be able to, and you follow it with an action verb. If you always are very clear about what your learners will be able to do after they watch their video or hear your lecture, or whatever it is, you'll be more efficient in creating the content, and it'll be more effective. So what we ended up with was 2 modules. And so we had one called What is Cognition and one that's called What is Dementia. And the reality is the way this nursing school had organized their curriculum initially was that their initial talk of what is cognition, they wanted to introduce them to some dementia themes, but also include things like autism and Down syndrome and all these things. It was kind of, any of you involved in education know there's never enough real estate in the curriculum to cover everything you want to cover. So we had to kind of accommodate that and work with that. But then we designed these learning objectives kind of based on theirs and adapting to, what we thought would be most helpful. You don't have to read all these. I think the things to point out, note that each one starts with a good action verb. So the students will be able to analyze something, summarize something, list something, and so on. And just overall, you can see the first one is more about these 5 domains of cognition, memory, language, executive function, attention, and visual spatial. Whew, did it. And then the second one was more focusing on dementia versus MCI. How do you distinguish from delirium? How do you distinguish from mood disorders with pseudodementia, all that. And then a kind of a nested experiment we did in these videos. So the first one, like what the video you saw a minute ago, had characters talking. So you had Raymond and Bryan being the voices of it. And so you never heard a natural speaking narrator's voice. The characters were running the show. The second one was just a narrator speaking, and the characters were still there, but they weren't doing the talking. And this might seem like a very frivolous thing to mention, but from a scholarly med ed standpoint, no one's actually rigorously looked at that ever of like, how is that received? Does it make a difference or not? So we'll pick up on that at the end of the talk. So that was a quick one, learning objectives. So educational strategies. So here's where the fun comes in. Oh yeah, we do have another video. Great. Okay. So, and now this.
Oh, hey there, Bryan. What you be working on?
Oh, hey there, Pseudomonas. I'm just working on this presentation. I'm just trying to show a quick example of how technology can be used to create artificial experiences.
Well, why the blazes would you want to go and do a thing like that?
Oh, well, because the evidence actually suggests that if we get learners to feel socially immersed in what's going on, they seem to actually learn better.
Aye, ye be referring to the use of social presence and judicious application of the dual coding theory in the context of pedagogical multimedia to optimize domain load.
Yeah, that's like exactly right.
Well, why didn't you say so? If you want them to feel socially present, we should be talking directly to them.
Oh, well, we could.
First things first. Time to break the fourth
don't.
wall.
Pseudomonas, did you just break their screen?
Ta-da!
Okay. So now we're going to focus really on the technology stuff, the stuff that gets me excited. And I understand the audience includes people from across the kind of geriatrics world. Not everyone's super in education. A lot of the things we're going to talk about also apply to educating the community, can be applicable around a lot of contexts, educating family members, caregivers as well. So I'm going to throw around a lot of terms, and so I just wanted to organize these for you because I might accidentally use things interchangeably. So technology, I'm not good enough to define technology, but technology is like the big bucket, right? And then multimedia is technology that involves giving information through your senses. So podcasts, video, infographics, pictures, PowerPoint, all that's multimedia through your eyes, ears, maybe other things. Video is any moving pictures, right? And then animation is video where it's artificially simulated objects. So I'm not filming something with a camera, but I'm using some method to make images look like they're moving. So I'm just to throw out the terminology so we know what we're talking about. When talking about education technology, there are a few frameworks that are really helpful and are used a lot. So I figured if you haven't been exposed to them, I'd introduce you to them here. One is called the TPACK model that you see here on the left. The idea of this is that you or your team are going to want to think about that you have the necessary skills in each of these buckets. So in the project that we're talking about today with this geriatrics nursing curriculum, the rest of the team, not me, had the content expertise. There were geriatricians and nurses and all these folks who said, we know all about dementia. And they came to me to kind of help with the yellow and the red, right? The concepts of how do you teach, and then the technology piece of knowing how to do animation and video. So, and after this talk today, you all will come away moving your dot a little bit from the blue towards the yellow and red a little bit more. You'll have a little bit more of an awareness of how to collaborate and think about those aspects as well. There's another really cool model for education technology called the SAMR model. And it refers to, like, if you're going to use a technology, don't just do it because it's shiny and new. Have a reason for it. Like, what does it actually add? And I've seen this metaphor with the pumpkin spice latte. So the idea is, you have just a cup of coffee and you're just substituting for a cup coffee you make at home. Then if the coffee shop makes a latte, that's kind of like an augmentation of what a cup of coffee is. Then you get the caramel macchiato, which is really a more of a redesign. And then you get to the pumpkin spice latte, and you have people at Starbucks at 8 p.m. when they shouldn't need caffeine necessarily. And you've just kind of totally distanced from the original function of the original coffee. So the same way that Zoom, think about what does Zoom add to an in-person meeting? And maybe that's an augmentation, maybe a modification, depending on what features you're using, right? So any technology you use, you can use the same model to think about how actually meaningful is the technology and worth it. So should you make new media? So let me fix my thing so I can see the chat a little better. Sorry, I'm doing a weird thing here. Okay, so if you wouldn't mind putting in the chat, actually, should you make new media? So let's say you're in a meeting, they're talking about, hey, we really need to, these geriatric students, they really don't know about gait assessment, man. And then someone's like, maybe we should make a video. What sorts of factors should you consider with your team of whether you should even make a video at all? Great. So availability of the technology. So yeah, great. And then funds and tech expertise. Great. Yeah. Other thoughts? And by the way, funds wise, I still use all free software for all my animation. So there are ways around the funds issue, but it definitely helps. Time left before it's needed. Awesome. Yeah. Audience and dissemination. And I like that because videos, right, once you make it, it's a lot of upfront work, but then once you make it, then you could maybe use it across time and space and context. Great. I like Amy's. So what are your learning objectives? Yep. Speaking my language. And then, would that be best addressed? And we could talk about that. What objectives might be most conducive? The tech support available. And better than existing. Yes. Awesome. And so we'll touch on that. Wonderful answers. Very thoughtful. So so first of all, to Marissa's point, what's already out there, right? Are there already other videos, podcasts, modules, and curricula? Maybe your job as the educator is just to curate for your learners what's already out there, and that's fine. There's no shame in that. And then, or maybe there's a great in-person speaker or lecture or something locally available. I'm not up here to say that like in-person interactive lectures and workshops are worse than a good video. They're not. This is just, there are reasons to use each. And then what are your resources? And so people identified these, but so maybe you have people with art or photography background, or, you never know. I think in healthcare, we have a lot of people who started as something else or had other interesting majors in college and then moved into healthcare. So I think these people are always out there in every med school class, nursing school class, and so on. Tech experience. Do you have time in your schedule, right? So just the protected time to do this stuff. And then funds, as people mentioned. So yeah, all reasonable things to think about. And then remember, this is all part of your needs assessment, right? So this goes back to when you're doing those first few steps and before you decide your pedagogy, what is the lay of the land here? Who do we have on our team? And then additionally, as people started to allude to, are the learning objectives beneficial? Does it help to show it visually? And is it something learners find difficult or have misconceptions? There's supposed to be a video here. I think it didn't pop up. Okay. And then some people say videos might be best for things that are foundational or evergreen. So things where they watch the video to build a basic context, and then you do more higher level learning in class. So one more cerebral thing I'll mention, and then it'll get less cerebral, is the idea of cognitive load theory. And this comes up a lot. If you dig into the literature on videos and animation, everyone likes to, base what they're doing in some sort of theoretical groundwork, and cognitive load theory comes up a lot. So I'm going to kind of briefly expose you to this. So I'm going to show you this animated allegory metaphor about cognitive load theory. And all you have to know before I start it is that long-term memory is a big warehouse, working memory is a boat with limited capacity, and our learner is over down here on the right trying to dig through the dirt looking for some useful information. So I'll hit play and see if I can still do this. So again, I'll fast forward a little bit. So, okay, I'll start from here. So you have this working memory boat. Our working memory in our brain can only hold information for about 30 seconds and to a limited degree. Come on. And then we have this poor learner down here who's digging through some dense textbook with too much extra information they don't need to know, and they're just trying to find those few green and purple nuggets of useful information so they can learn how to distinguish an antalgic gate from a Parkinsonian gate from whatever, right? But there's all this extra detail in there about different types of durable medical equipment. And so what they're trying to do is they're trying to find just the useful nuggets and put them on the boat. And then quick, before I forget, let me put that working memory into my long-term memory. But it's not organized really. And so you only get a little bit of that information stored into your long-term memory. But what makes it in there, it sticks. There's plenty of room in there. It'll last a long time. But so our job as teachers is to figure out how do we make things more organized and efficient when you're loading that information. So if we use organizational frameworks, schema, present things in a more organized way, now there are these organized buckets. So as the learner is listening or learning from something, they know, oh, this is a green bucket information, this is a purple bucket information, and that goes more efficiently. And in this metaphor, cognitive load is really the gas. It's the oomph the brain needs, or how much caffeine you need to get through the learning task, metaphorically. And so now the question is, if you invest a little more fuel in an even more complex learning tool, like some animation with more cognitive load, is it worth it because it so effectively loads information in a more organized way? And so any teaching tool you use is sort of a gamble, right? It's like, is the complexity of the learning task, is the stress of it, is the caffeine requirement of it worth it for how effective it is in enhancing learning? And so that's what educators deal with, is the gas worth the outcome? All right, so not sure if that allegory helped anyone, but there it is. Okay, so what are some strategies to mitigate cognitive load in videos? So PowerPoint does some of these. So signaling, an example of signaling is this, right? So anytime something moves, makes a sound, changes color, our brains pay attention to things that change more than things in the background of our lives that don't move. Advanced organizers and schema. So an advanced organizer is like the Venn diagram, right? So if I put two circles overlapping on the board and I put dimension delirium, you all know probably from just something ingrained in you since elementary school, what kind of information am I about to give you? I'm about to give you comparing and contrasting information, right? So your brain is like, okay, I'm ready to receive comparing and contrasting. So right now you wouldn't pass a test on dimension delirium, but you're about to be really ready to receive information. Emotional designs. So if you all remember Clippy from Microsoft in the 1990s. It turns out there's a body of evidence that says if you make learners feel emotions, usually happy ones, usually positive ones, but maybe negative, we're not sure, while they're learning, they will learn better. And so some common things that have been studied, one is just colors. So high saturation, bright colors can, I guess, make people happier. And then anthropomorphic design. So putting smiley faces and eyeballs on inanimate objects and different things apparently makes learners happier on average and helps their learning. Avoid audio-textual redundancy, which is something I'm not doing a great job of today. This is the idea that it actually, even though presenters, like I'm failing to a little bit, will sometimes just read off their slide, that actually isn't good for cognitive load. You actually waste cognitive load listening and reading the same stuff at the same time. So hopefully I don't do that too much. And then keeping things short, right? So if you're making a video, just don't make it too long, which is easier said than done. And then there's this really cool thing called telepresence, which we studied with this project. So since the age of reading books and all the way to the world of virtual reality, there's been something that psychologists have studied called telepresence, which is this idea of the degree to which you were there in the world of the media and not here. So when you go to the theater, the first time you saw Avatar in theaters, how much did you feel like you were on Pandora and not in your smelly seat in the movie theater, right? So that's telepresence, and it's something you can actually psychometrically look at with surveys. Okay, last cerebral thing, I think, I promise, is this idea of synergy of the senses. So there's this idea of dual coding theory, or the cognitive theory of multimedia learning, that came around in the 90s and early 2000s. This is the idea of what we're doing now, the idea that that ship with limited working memory, if you use visual and audio inputs in a meaningful way, you'll expand the total working memory, expand that capacity. And when I was studying animation, at the same time I was learning all this stuff, I realized there was a word that kept coming up in the animation world that reminded me of this concept. And that word was magic. And I don't, say this just to be cute. And I think, Disney uses the word magic in a lot of ways just as part of their marketing. But there are a few reasons that the word magic is associated with animation. One is historical. So one is that the earliest use of animation, there was this Gertie the Dinosaur magic show where a live person would feed an animated brontosaurus on a screen and different things. And so it was basically like a magic show. But another reason I think is that the production process. So when you have a professional, traditional animated film, it was a lot of people each doing some sort of tedious menial task. And it wasn't until you put together the sound, the visuals, the music, all these aspects that suddenly magically this thing was alive. And so I think that experience of those animators seeing this as magic, they were experiencing in part the dual coding theory, the synergy of the senses. Okay, so hopefully you're sold. All right, so implementation. So if anyone wants, I know we're not as, does anyone know, I'll just give it, this image is a literal representation of a metaphorical concept in medical education. It's a stupid joke. I don't know, does anyone put in the chat what they think it is? It's a classroom, but it's a flipped classroom. Thanks, Kate. So yeah, so there's this idea of a flipped classroom. So this is kind of a hot term that people use. Generally, it just means you give the learners something to learn, usually the basal foundational information, like on their own time, asynchronously. And then they're better equipped that when they spend the precious time with all of you, these wonderful geriatricians, that they can then do more interactive, higher level application of their knowledge. And so one way, but not the only way, to use video and multimedia is to have it as that first part of the flipped classroom model. It's not the only way, but it's often what comes to mind for many people. And so there's literature on flipped classrooms. They're generally effective if the materials are good and deliberately designed, and they have to actually do it. So depending on what health profession you're in and what stage of learners you have, they may not do the homework you give them. And so flipped classrooms are only as good as if people actually do them. And then blended learning, I really want Ninja Blenders to sponsor me. I made a smoothie yesterday. But blended learning is just a broader term that refers to using a mix of kind of synchronous in-person teaching elements with technologic elements. And again, this general idea is that just a video or just a lecture or just in person is never going to be as good as a combination of both. Learners want to be diversely entertained and engaged in different ways. So just mix it up. So making it interactive. So definitely any way to make any kind of media or video interactive is definitely going to improve learning over just passive viewing. And so definitely, you know, it's not going to shock anyone that if you watch something multiple times, it increases gains. But then even minimal interactivity, right? So if it's a situation where the learner has the ability to pause, rewind, fast forward, and change speed, or navigate between sections, that's going to improve engagement. If possible, add some sort of quizzes or other interactive elements. So I put here, these are a few programs I've used in different projects that are out there, some free, some with some pay scales, to add embedded pop-up questions and things in videos. Feel free to screenshot that if you're doing this kind of work and want to check those later. And even if you don't do that, just do what I call the Blue's Clues style, which is the idea, if anyone's seen the kids show Blue's Clues, right? There's no interactivity from a technology standpoint, but the speaker just looks at the screen and says, can you find the next clue? Or like, do you know what says oink, right? So you can have the voice in a video just speak to the learner. And then in this day and age, should the learner be making the content? And something that someday I'm sure I'm gonna have to start incorporating in my talk more is with generative AI especially, right? Like it's gonna become easier and easier to say, hey, student, you create a video about gait assessment or dementia or whatever you're teaching, right? And then you teach the group, right? And so that would be, of course, even more engaging. So we've talked about video. Now we're going to hone in even more specifically on animation. This, by the way, is some of our brain emojis representing the different etiologies of dementia from our project here. So what it takes to get started in animation, it does not require proficiency as an artist. There are a lot of ways just with motivation, patience, and open-mindedness. I really personally fell in love with it as like a thing in my spare time too. But I think there are definitely ways to incorporate it. This is just a fun exercise that I think we have time for. So the types of animation as the film industry sees it are different than what the average article in a publication about educational animation is talking about. So in the film industry, these are 4 big buckets of animation. So one of these, and this could be interactive, so you can type in, one of these is an example of traditional 2D animation, meaning an artist had to draw every frame, frame by frame, basically like a flip book, to create the image. Does anyone know A, B, C, or D? Which one would be traditional 2D animation? Yeah, I'm seeing some B from K. Yeah, great. So this is Schoolhouse Rock, How a Bill Becomes a Law. So traditional 2D animation does require probably the most artistic skill and accuracy, not for the faint of heart. But of course, it also has limitless possibility. Oh, and I'm seeing a message from Pamela here. Getting the students to do pre-work is the greatest challenge as an educator. Yeah, usually half the class does the reading. Huh, you found Panopto unreliable. Okay, interesting. I had a pretty good experience with them in the past. These days I use PlayPosit more because my new institution doesn't have a Panopto subscription. But interesting. Yeah, I'm not sure about that piece. But yes, to your first point, 100%, which is why I've done some projects where I knew in my heart of hearts, in a controlled environment, I would have done a flipped classroom model, but instead I just gave up and used the animation as part of the in-class experience. And as long as they're not wasting their time spending the whole session watching a video in class when they could do it on their own time, it was mixed with other interactive elements, it was still well received. And even people put in the feedback, we probably could have done the video at home, but I realized no one would do the homework. Like people literally wrote that in the feedback. So I think they have insight into this issue too. So yeah, it's a really tough challenge. Same with completing surveys. Okay, so one of these is an example of 3D CGI animation. So this would be, so A, B, C, or D, feel free to type in. So this is an example where you use computer-generated three-dimensional shapes, totally different software and learning curve. Can also be learned, but just different. A, B, C, or D, which one is the? Okay, no, it's typing in. To move things along, so that's D, so this is from Shrek, the not the gumdrop button scene. C is 2D vector animation, which is actually what I do. This is actually a clip from a diabetes-related video I did. And it's kind of, and we'll talk about it in a moment. And then the least I've seen in medical education is stop motion, like claymation. I would love to see some more claymation projects in geriatrics, that'd be great. So I use something called 2D vector animation, which is really nice. It's middle of the road. You can do very simple shapes, like those HIV molecules, all the way up to character animation and everything in between. There's free software to do it. Yeah, so there, you can start with very simple as a novice and then get more and more advanced. And it uses something called auto in-betweening, which means I don't have to draw every frame like traditional 2D animation. I just draw some key shots or poses, and then the computer kind of helps transition the shape between those. So it saves me a lot of time. But when you look at the literature, a lot of the time people talk about animation, their work is actually just this. Just what I call a digital chalk talk. So just PowerPoint slides with writing on top of them. So my point when I teach this to, people doing more like med ed scholarly projects is, read the fine print of like, what are we talking about when we say animation? But these are all very successful, effective tools as well. So it's just, and they probably are quicker to make than some of the other methods. So it's all just knowing what you need for your objective. This is an example of the other extreme, right? So if you're a large pharma company or have a huge grant, you could hire a professional 3D CGI company to show your antibodies and your drug and all that, in high fidelity 3D CG. And if you're me, you can get free software and start to dabble in 3D animation as well, like these very simple blobs for aquaporins and sodium channels and whatnot for teaching hyponatremia. So, okay, this part's interactive, so I will need participation. So this is a quiz, and there's no right or wrong answers. It's just to get the gears turning. So for each of the following scenarios or learning objectives, I want you to tell me whether you think you'd use animation, video, or just static pictures or images. Oh, I'm sorry, that's coming up in one more slide. So, so things to consider. So you might use animation when things are not easily captured with a video camera. So it's a rare event, hard to capture, or it's microscopic or telescopic. Sensitive or less approachable topic. To show a dynamic process where elements are interacting and moving. Something where you need to explain spatial relations in a way that doesn't easily fit into a simple 2D plane, like this nephron. Or to visually represent an abstract or metaphorical concept, which is my favorite, like making these little incretin Gila monsters crawl from the from the gastric valley to the Isles of Langerhans to induce insulin secretion. And then finally, enhance affective elements, right? Back to this whole emotional design idea, make our learners happy. Like this brain that is struggling to lift weights. Okay, so here's where I need participation. So if the objective is students will be able to perform a goals of care discussion with an older adult or caregiver, and you had to do this project, would you use static images, live action video, or animation to teach them? Great, I like the abbreviation, it's nice. Live action video, yeah, I agree, right? And that makes sense because animation would be a waste of time because you're just filming real people that you can point a camera at, you can do a simulation, and yeah, that'll be quicker. Okay, what about describe the transport of gases by red blood cells through circulation? Yeah, maybe a little more animation, right? Because you can't point a camera at it as easily, but it is a dynamic process. Great. All right, what if you have to memorize the names and shapes of organelles of the cell, including Golgi, rough and smooth ER, nucleus, mitochondria, etc.? Yeah, static with colors. I like it. Yeah, yeah. Yeah, you could animate it, but there's really no need. I mean, you could have a cool thing where you go like a roller coaster ride flying through the cell, but is that worth your time and budget compared to the static images? Questionable. Okay, recognize the signs of delirium in a hospitalized patient. Interesting. This one I get a little more debate. There's no right answer. So here, live action video. Okay. Because it is human beings. Any other counter arguments? It's okay if not. Or what might be the challenge with live action video? Or is animation feel sensitive? Yeah. Yeah, that's kind of what I was thinking when I created this question, is that it's sort of, you could pick between live action and animation. So on one hand, if you feel like a standardized patient actor can kind of act it out effectively, live action might be okay. But you could also do it with animation if that makes it more approachable for an early learner. If they don't want to see like something direct, you probably aren't going to film a real person delirious because the consent process for that is very challenging. So that one's kind of on the cusp. So thanks for your participation. So I'm going to move a little faster. So this part, I usually talk a bit about characters as advanced organizers. If you have me back for more of a workshop sometime, we can all design characters together. But this is my pantheon of characters from a diabetes drug project I did, where various features of each character function as advanced organizers, telling the learner things they should know about the drug. So I start with a one-liner, such as this: Can a glyph flows in as a hip British celebrity seagull with the outfit of an arrogant pop star holding a sweet tea who loves to promote his product and denies that he ever beat anyone up to cause fractures or amputations. So you can see how just in a one-liner of a character in this format, I've already created a bunch of context that's going to lead to some learning. Any character you're designing for a geriatrics project or anything, you could use this kind of Mad Libs format of my character is an adjective noun with this and this, who loves this and hates this. I'm going to kind of breeze through this a bit. Any visual you're creating, you can use these 4 Ds of design. And so if I want to make a seagull character, I'm going to look at pictures of seagulls, but I'm also going to look at how other people have drawn seagulls to see what features they focus on to catch its seagullness. Then I'm going to do a design or dream stage where I intentionally create a lot of diverse types of seagulls, intentionally different from one another. Then I develop or refine my design. So I say, hey, I like the sweater from this one and the shoes from this one and the beak from this one. And then the deliver phase where you have your final product. So here's just some sketches from the Geriatrics project where very early on I was like, how do I want to animate and draw older adults? And I looked at various reference images, and a lot of them had like visceral adiposity and different shapes. And so just thinking how to kind of simplify that. And it kind of evolved over time. Eventually came up with this kind of brain character who's struggling to lift weights, and this Raymond character kind of rose to the surface. And as it developed, we came up with this kind of visual style, no outlines, kind of these simple vector shapes, which would both save me time and make it low cognitive load. So that's kind of just a glimpse at kind of the design process, how it was an iterative thing. Something I haven't emphasized enough in this talk so far, but is really important, is even if you're sitting here saying, I'm not going to be the person doing the animation or art, the point is that by watching this grand round today, you'll be a functional collaborator in that. So whoever you're working with, creating videos or animations or other visuals, you can still have a voice, because there are all these planning steps where you can weigh in and say, oh, I actually think we should have more racial diversity in our characters. Or, hey, I think that character should have a different posture because they have this geriatric disorder. Or so, you can weigh in with your content expertise at every step of the development process before the hours of video making actually commence. So with that, let's go to planning a scene. Again, all about deliberate steps before you do the final animating. And so here's Raymond talking about, I think it was executive function or something. Oh no, yeah, about not getting frustrated with tasks and things, and then brain ruins his train set. Anyway, composition and storyboarding. So for composition, this is about planning what's in a single shot. So if any of you are into Instagram and any of that, this is kind of what it's all about. It's not my thing. Here I intentionally messed up a picture. So if you'll bear with me, this is from the Curbsiders podcast, a medicine podcast where I helped with some infographics back in the day. And this is a messed up version of a picture for an inhaled bronchodilator with a inhaled corticosteroid inhaler riding on its back that's biting some beta receptors and punching a T cell. So take that, let that marinate. But what might you do to make this image more clear, to emphasize things like the mechanism of action and take out extraneous cognitive load? How would you edit this image? No wrong answers. It's a mess. Remove excess receptors. I agree. Get the point across with fewer receptors and not being in everyone's face. Sure. So yeah, so foreground, midground, and background. Simple enough, right? Other things? Straighten the neck. Oh, so it's reaching more. Oh, that's a good idea. I agree with you. I don't have that here, but yeah, to kind of get out of the way of the dinosaur. Yeah. Yeah, so that it's more yeah, and actually in animation, there's this idea of like having your motions and movements and postures be very exaggerated so that it's very hitting over the head. So I like that. I didn't do that here, but that's an excellent recommendation. Others? Brighten the colors, yeah. Okay, I'll go through this one, then I'll do the colors. So there's also something called the rule of thirds. So right now the action is all kind of crunched in the middle of the picture, and unless you're Wes Anderson or maybe Taika Waititi, you actually don't want to do this. Most filmmakers and photographers will put the action of a shot on the intersecting thirds of an image. So we're going to crop it a little different to focus in. And then yes, we have some colors and things here, I think. So we're going to shrink those beta receptors, we're going to brighten the colors. And so anyway, yeah, great. Taika will break that fourth wall, yeah. And then, so yeah, that's where we started. Here's where we ended up. And then, of course, signaling, right? So motion also draws attention to things over the static elements of an image as well. Ta-da. Okay, so if that's composition, what do you call composition over a series of shots in a video? That's called storyboarding. And so you might recognize this Alfred Hitchcock's The Birds, and this is the real storyboard, and much nicer than my storyboards. But what you can imagine is that there's this planning step before you make the final video. And then it's very similar, and it saves you budget because you know what shots you need ahead of time. I think for sake of time, I actually need to move forward. So I'm actually gonna skip that clip. Here are some clips of storyboarding from the Geriatrics video. Sorry about that, I crammed a lot into this one. So overall, I hope you see that there's this kind of inverted pyramid approach where you put a lot of upfront planning work and then it zooms in. And that's the case for animation as well as for curriculum design. And I was going to push ahead so we could see some outcomes. Any questions at this point before I move and just talk about the outcomes from our nursing curriculum study? Animation, how to get started, how to collaborate with people. Okay, I'll keep pressing on. Sorry about the time management. Okay, so implementation and feedback. So we made two videos, the cognition one and the dementia one. We wanted them to be under 10 minutes. We failed. One was 12 minutes, one was 15 minutes. For people who completed the full assignment with the video and the pop-up questions, it took an average of 25 and 21 minutes respectively. This is an overwhelming table, but I'm going to point to a few things. One is when you do a med-ed project, collect all the data you can. Number one, collect that denominator. How many eligible students could have watched it? And therefore, what is your response rate? You'll see that Nursing School 2, watch them as one combined assignment, and you'll see across this that led to worse response rate and everyone being unhappy and responding to things worse. So 2 smaller assignments was better. And then, funny contamination. So in the first site, so many faculty wanted to watch it that they accidentally used the link for the students and contaminated our sample, so we don't have an accurate response rate. And then we did do a basic knowledge measurement because they had a pre-test and then they had embedded quizzes within the videos, and we did show a significant increase in knowledge. It wasn't a challenging quiz, but at least we showed information was registering. So then we did more evaluation. So we wanted to look at their impact on, again, how they feel about dementia, right? These learners were kind of afraid, stigmatized, ageist, right? So we asked 3 questions: interest in learning more, comfort with dementia care, and future career interest. And the composite score of that we looked at, and it was very high across the board, but you'll notice again that at Nursing School 2, where the assignment was combined, it was lower. They were pissed that they had one long assignment. For acceptability, we also asked if they would have wanted a reading assignment instead. Only 3 people at the unhappy institution said yes. Otherwise, no one else said they would prefer reading. And then the majority of people at every site said they strongly preferred video to any hypothetical reading assignment. I've also done this with some of my projects. I call it a composite acceptability score. So I look at different parameters. I ask them about the clarity of the video, the complexity, the relevance, maintaining attention, and how entertained they were, and then use that to kind of look at how acceptable the video was. I won't explain Chromebox Alpha now for sake of time. You can ask me after if you want. And basically very high rated across the board. 3 of the parameters were very highly rated at NS1 and NS2. But at the unhappy combined assignment place, their maintaining attention and their entertainment went down. So that makes sense. They were not amused because they had a longer assignment. So, and then finally, we did look at these aspects I told you at the beginning, right, of characters talking versus my boring voice talking. I was worried they would just hate the voices, just like, this was terrible, like, you should, like, what are you doing? But there was actually a slight shift towards preferring the characters with a widespread. And what I saw was that some people felt like their intention wasn't maintained as well with the characters. So if people were more of a struggling learner, maybe they wanted the really straight, cut and dry narrator, but people who were a little higher level probably could handle the character to kind of keep them awake and engaged. So it's really interesting. There was kind of a diverse preference there. And then this construct of telepresence. Oh, this is more about the voice. I'll skip that. And then we use 3 questions from a validated telepresence sort of survey instrument. And interestingly, there was no significant difference. So they felt moderate high level of immersion in the video, whether we had the characters talking or the narrator talking. So take home points, I can now decelerate, and then, so sorry for breezing through. But begin with the end in mind, which I think is a tip from 7 Habits of Effective People. Consider learners' feelings, biases, and experiences. So especially for geriatrics, don't just focus on knowledge goals, think about attitudes. Teach to the objectives and the needs. Don't add fluff that's not relevant to those. Shiny ed tech does not equal effective ed tech. So the Apple Vision Pro came out. People are buying coffees while pointing to things in midair. At some point, your health profession schools are going to say, should we get some Vision Pros for people? You have to decide if it's really worth it. Cross disciplines. So within yourself, so learn a new skill, and just across your team. So this is really fun, right? I had this animation kind of hobby and interest. I worked with geriatricians, I worked with nurses and physicians. It was a really fun collaborative process, and I really liked that model where everyone had kind of these diverse things to contribute. Make it count twice or more, right? So once this beast of a project was done, we could use it across multiple institutions. We could use it for different levels or stages of health professions learners. And now I have this thing. And hopefully the definition of vascular and Alzheimer's are not going to change that much. The definition of delirium is not going to change that much. So I can use this video for years to come across different learner groups. And then finally, and then measure multiple things. Like, don't just look at, did they learn? Look at impact on attitudes. Look at whether they like the video. Look at constructs like telepresence. You know, there are so many things to look at with a single project. Whew. So with that, this is an evaluation to let me know how I did at this early hour. And then also this is a QR code to my MedEd Animation YouTube channel, where I have a bunch of tutorials and other content if you want to do a deeper dive into this work. My email's there if you want to talk MedEd, talk animation, use our videos for something. Totally open to talk to any of you. So I'll just leave this slide up, and with the remaining time, if I have any, happy to take questions. Thank you. And I'm seeing a question here. So I'm seeing Barbara, flip classroom pre-work. What are your thoughts about incorporating short quizzes or other strategies once they're in the classroom that persuade? Totally, yeah. And it depends on learners. So in the medicine world, which I'm more familiar, I think UME, so medical students, it's easier than GME. And I think at the UME level, it's just a matter of very clear expectations. My sense of modern med students, and I assume for nursing students, is just they don't want the trauma of unexpected pop quizzes, but if the expectations are clear, say watch this video and then you will get a quiz that will count towards this grade in this way, then yes, I think that will be motivating and they won't be mad. I think you get in trouble if it's more of a surprise. GME, you're kind of in trouble because they just have to be self-motivated, and it's really tough. I mean, the aspect of being kind of quizzed out loud and the public shame, like peer pressure kind of thing, might do a little bit, but that's a tough nut to crack. Yeah, good question. Other thoughts or questions?
I was wondering if, you mentioned briefly AI. Everyone's talking about AI. We stopped talking about COVID a little bit. Now we're talking about AI. So I was just wondering how you think it'll impact this type of education format.
Yeah, totally. Thanks for asking. So a couple ways. One is for the educators, just speeding up the process. So I had one image in this whole talk that was AI generated. It's the first time I've actually done it for real practical purposes. I'll bring it up while I'm talking, but so it can save us time, and it just, and making videos and all kinds of things. Here, let's see if I can bring up that image. This guy was AI generated for my tech expertise person. That was my one picture. So for educators making content, for sure, it can make it so that you don't necessarily need someone like me who spends a lot of hours making animations. And then the other side that I think is really cool, though, is the the idea of learners making the content, like make the assignment that the learner makes the video, the learner designs a character to represent something. That level of active learning, I think, is going to be really effective. And now you don't have to worry about someone's like, oh, I'm not a good artist, because all they have to know how to do is make a text prompt. So that's really exciting. Kay wrote, thoughts about chat. Is that supposed to say chat GPT? Is that a typo? Chat waterfall? Or I'm not sure what chat waterfall is. As an
No,
interactive.
I'm sorry. Maybe you don't use this.
Oh,
I have
sorry.
education friends who turn my video, sorry, who use like a chat waterfall. So they'll like pose either a question or a thought or just like a response, right? Like they just want like someone to be like, give your reaction, kind of verbal, like word reaction to this concept or this feeling or this experience. And they'll have everyone kind of like post it all at once at the same time, as a way to kind of, generate, I think, enthusiasm, build a little bit of community, as well as kind of like maintain interest and interaction. So I'm just curious if maybe others have utilized that or think it's effective, not effective. I'm just curious.
It sounds great, but yeah, and are you referring to people kind of all typing in, or more like a video reaction? Oh,
Yeah, they type it all into the chat at the same time, and then press go, kind of all together. So it's like all appears like all at once, look like a waterfall.
Yeah. Oh, got it. Yeah. It definitely sounds like a useful tool. Yeah. Yeah. Thank you, Kay. I apologize that I'm at. But yeah, it sounds good. Other.
I have a quick question. This is May Reed. Copyright issues. I mean, sometimes so when you do these animated short things, but they're for education. Yeah. Anyway, I'm just curious.
Yeah. So copyright. So as far as like the content I make and my copyright to it, or
anybody's that. I mean, it's so easy to get stuff right off the internet, pull it off, snapshot it, whatever. And yeah, I was just wondering, can you have as long as it's used for educational purposes only? Is that still in play for these type of things? Yeah.
Yes. Yeah. Good question. Yeah, I see what you're saying. So yeah. If there's something out there that's great, just if for teaching purposes, if you're not like making money off it and selling it, totally. Yeah. You can just show it, give it credit, cite it appropriately, just like we model for our learners generally, right? With any source, but absolutely. Yeah. You can, as long as you give that thing credit. And then for things you make, by the way, it's pretty easy now. Once something's posted somewhere, like the metadata in that, like if you're the first one to create a video and then post it, like you do kind of implicitly own the copyright to that. So for example, putting something on YouTube or on some personal website or something kind of protects you in some very basic level for someone else just like stealing it and selling it, which, be so lucky to have something that people like enough to do that. But anyway, yeah.
Well, thank you so much for taking the time to speak with us today. This was a really great presentation. It made me think about a lot of different opportunities while you were talking, and I really, really appreciate you sharing your innovative approaches to medical education and answering our questions. This is really fantastic, and I bet it'll get a lot of hits on our YouTube channel. So you might have more questions out there after this. So cool. Thank you so much for taking the time so early in the morning. We really appreciate it.
Yeah, thank you so much for having me.
Thank you.
Good to see you, Gina. See you.